Navneeta here once again, and today I'm still pursuing the beautiful eyes, the beautiful bright and shining eyes. I'm yet again here at Eye Foundation with our doctor, the chairman, Dr. Ramamurthy. Hello sir.
Hello.
Good evening. So I'm again behind you to know more about eyes and more about surgeries. So today sir, I want you to tell me about the latest technologies, the advance that we see now with eye care.
One of the commonest problems in the eyes, as all of us know, is the need to wear glasses, and that's what we call refractive errors. And they can be minus power, plus power, cylindrical power. Now we have very advanced, reliable technology to completely do away with glasses. It started off as LASIK, where we reshape the cornea to correct refractive errors. And this is a simple procedure which can be done in both the eyes at the same time, and the patients can almost return to their normal activities the next day. It's not just the simple powers, but also extremes of powers like minus 20 or a plus 8. Nowadays we do something called a phakic intraocular lens, where we fix a lens inside the eye. So almost any patient above the age of 18, once the power is stabilized, we have the ability to completely do away with the need to wear external optical crutches like glasses or contact lenses. I think that's one of the major advances that have taken place in ophthalmology in the last 2 decades.
So this is absolutely no need of wearing glasses, and this is possible for those between the age of 20 and 40.
Usually these are the patients who come to us, though there's no upper age limit. We can do it even in elderly individuals, but most often it is the age group that you mentioned who present to us for this kind of correction.
So I have friends, my brother wears glasses too. So for some of them, they like wearing stylish, flashy frames, or they think it's nice to keep changing glasses, and it's fun to use glasses. But for a person who's seen my brother, who's into a lot of sports, a lot of active day-to-day things that he does, it's really difficult to have these glasses. You're so dependent on them. So why do you think why do you think we should get this message out to the people, to the youngsters especially, that we can remove glasses, and it's a good way to do it, and it's good for them to do it?
The first thing I would like to dispel is the myth that refractive surgery is cosmetic surgery. When we started with LASIK almost 20 years back, we thought it to be essentially young ladies who are just about to get married who are going to be presenting to us. But right from the beginning to till this day, it's almost the distribution as far as males and females is concerned is equal, because it's not just the need to take off glasses for cosmetic reasons, but as you mentioned, there are sporting activities, there are professional activities where glasses are a hindrance. And especially when you talk about high powers, it restricts the field of vision, the quality of vision. The ability to function without glasses, of course, has a cosmetic advantage in many patients, but also is life-changing for them. And they do feel that the quality of life once they undergo this surgery is significantly enhanced.
And this surgery, it does not take a long healing period. The procedure does not take much time. I understand that if
that's absolutely right. I mean, we do both eyes at the same time, just instilling topical drops, no injections. The patients can, it just takes about 5 to 8 minutes to complete both the eyes, and they can get back to all their normal activities right from the next day. Often I am asked, I'll come during my vacation to get this surgery done. We of course do not mind doing it anytime because it's an elective procedure, but the same patients can even just come over, get it done on a Friday or a Saturday, and they're good to go and get back to their college or their professional activities right from Monday. Whether it's watching TV, reading books, working on their computers, indulging sporting activities, traveling, all this they can start doing right from the day after the surgery.
So that's great to know. I'm definitely going to recommend this, and I'm sure many watching our video will also understand how important and what kind of an eye-opener this is, to know that you can get rid of your glasses and it's not difficult, it's not complicated anymore like how it was before. Now, we've talked about LASIK now, or the laser correction that we do. We did talk, our previous video, we did talk about cataract surgeries and how restoring vision for elderly people. Now, I've heard that diabetic or being a diabetic patient can also affect your eye. How does, what does, because diabetic is something, or being a sugar patient or being somebody affected by diabetic is just the second person that you meet. I mean, if you take our home, it's your dad, it's your mother, and for sure above 40, 45, most people we know, especially in India, are affected by diabetic. What has diabetic got to do with our eye?
I think you asked a very important, relevant question, in the sense that India is said to be the diabetic capital of the world. We have more diabetics in India than any other nation in the globe. And because we are able to control diabetes with medications, insulin, with life changes, these patients are living longer. And the diabetes affects the eyes, the kidneys, the heart, the blood vessels, depending on the longevity of the prevalence of the disease. So if somebody has had diabetes for 15, 20 years, even if he or she has been well controlled, there are good chances that their eyes may get affected. So in these situations, what we call diabetic retinopathy, there can be waterlogging of the retina, or there could be bleeding in the retina, which causes a drop in the visual acuity. Unlike in cataract formation, where we just remove the cataract, place the lens, the patient gets back the normal vision. Most often in conditions like diabetic retinopathy, we're essentially struggling to retain whatever vision the patient's present with. So it's extremely important, just like a diabetic gets his or her blood sugar checked periodically, at least once in 6 months or a year, they should get their eyes checked after dilatation with a competent ophthalmologist. And if we do detect diabetic has affected the eyes, sometimes just good control of diabetes, periodic eye checkups is what is necessary. Sometimes we give injections within the eye, laser treatment, and if it's too advanced for all this, we do vitreoretinal surgery, which is a complex surgery. The good news is that if patients present to us in time with proper technologies that we have access to today, we can always ensure that all these patients have a full lifetime of good vision.
So for everybody that's tuned in with us today, get this clear. We see people taking regular health checkups. We see people, corporate crowds who are asked to take a day off and go get a complete health checkup done. So along with that, eye care, eye checkup on a regular basis is also very important, because I've heard people say, I can see, I can read now, so I can watch the TV. I don't do a lot of small notes, or I don't read a lot of tight books or anything. So I don't think there's anything wrong with my eyes. So even for those people, I believe this is an eye-opener again, because if you do have diabetic in your family, if you know that your elders are having diabetic condition now, you're prone to diabetic too, and you may be able to see very clearly and perfectly fine now, but maybe in another 5 or 6 years down, there are chances that your retina could also be affected. So it's always better to keep a regular eye checkup along with your
In short, the message that we would like to drive home is, if you have diabetes, get your eyes properly checked at least once a year.
Now, sir, you've talked about the latest technology. You've told us about cataracts and the surgeries and the advanced technologies and what all we can do to help our eye and things like that. But from my understanding, where I've been doing a lot of reading and things, I've realized that Eye Foundation is not all about a private hospital, or not all about just serving people who come to them. I know that there's a lot of charitable work, there's a lot of care or eye care or service that it's given out to those who cannot afford it, or maybe let's call it the underprivileged of the society as well. So how have you been giving the leadership to these kind of activities?
I think right from the time we started out with our eye care activities almost 3 decades back, we have realized that it's not just enough to provide cutting edge technology, but we have to cater to the social needs of each and everybody who walks into our hospitals. So because of this, we have a separate arm called the Netra Jyoti Trust, through which we direct all of our charitable activities. We do mobilize funds through our Sudarshanam scheme, where any individual who wants to participate in community eye care is encouraged to donate a small sum, and based on his wish, a particular day is set apart when surgeries are done for deserving poor people. And each and every one of our 10 hospitals has a community ophthalmology wing equipped with a van, a group, a team which goes out into villages, urban and rural areas, as well as schools, conducting regular school screening programs. And as and when eye treatment is needed, whether it's provision of glasses or a cataract surgery or more complex surgery also, we bring them back to the base hospital and provide them with appropriate eye care. It's our strong belief that every patient should be offered proper eye care irrespective of their ability to pay for it.
God bless, fantastic. Giving back to society what it's given us, serving our people. It's not just about care for just one particular class or one set of people. It's care, and it's eye care, and it's the best that you can give to everybody who's deserving, everybody who needs that medical attention. So God bless, great service. Eye Foundation, let's keep doing that. Thank you so much for being with me, and I'll still get back to you with more of such videos for our viewers, so that we can get to know more things, what's happening, what's new, what we need to do to keep ourselves, our eyes, and our what attention we need to give to our eye care. Thank you.
Thank you.
Navneeta with Dr. Ramamurthy. Thank you so much. Stay tuned.